things to keep in mind with that supply chain is one, the product expiration date, because the product's only viable for a certain amount of time. So before it even leaves the warehouse to go to the doctor's offices, you have to know when that product is set to expire, and just ensure that obviously if it expires in January 2021, you don't want to send it out now. So to be mindful of those dates. And then also if there's any special conditions, for example, for the one program where we're collecting blood specimens and shipping them to the sponsor, they have to be stored at minus 20 degrees. So ensuring that the samples have enough dry ice. And then we also have temperature gauges, which we call temp tails, and it tracks the temperature. And then we receive an alert if it drops below a certain threshold. So not only the expiry of the product, the conditions in which they need to be transported, and then also for delivery. Ensuring that the staff is available. We're getting into the holiday season time. So usually proactively we'll confirm with the sites, what days they're closed or if they're open on the weekends, because you want to ensure that someone's there to receive the product. You don't want it to be left outside, potentially thaw, someone to pick it up, all those types of things you have to take into consideration.
Supply chain considerations. We set this up, but we needed a lot of equipment, and we needed a lot of supplies to keep this testing site running for the 16 days that we ran it. That included things like sanitizers, and you can see the wonderful job the PA National Guard did. We couldn't come up with any sanitizers, but they located a distillery that had switched from distilling liquor to distilling hand sanitizer. And this was critically important to keep everybody on the site safe. Lieutenant Commander Mooney oversaw the general operations in terms of our safety, and hand washing, hand sanitizers, critically important to keep everybody safe. A supply of test kits that we could use every day. Food. The National Guard was stationed here. We had to feed them. Fuel to keep all our trucks and our generators running. And we quickly linked up with a local fuel distributor. I believe it was Mac Energy, and they kept us up and running. Personal protection equipment, the gowns that the National Guard needed, lighting, critically important. With all this equipment, there was security overnight, and Temple Police provided that. Traffic signage to direct people. The Upper Dublin Police Department did a wonderful job with that, as they did with traffic control as well. And again, I can't say enough about the registration software. It was critically important to making this site successful, as well as all of the personnel who came together, worked together, and and just having enough people there to get the job done was a supply chain consideration.
It became apparent that COVID was a real issue and a problem that wasn't going away anytime soon. So really in early February, the company started to say, hey, we need to think about what we're going to do and how we're going to respond and prepare for this. So typically in the course of a year, you have your goals that you want to achieve. And it's all rooted in our 4 core pillars of safety, service, cost, and taking care of your people. And safety has always been our #1 core pillar in our company. But it was all driven, especially in transportation, we're talking DOT safety, driver safety on the road, right? No distracted driving, the typical things you think of in safety. Well, COVID-19 thrust a whole new element into safety for us. And how do we first keep our people and our associates safe? And then everything else will follow after that. So we had to revamp everything we did, starting with safely admitting people into our buildings. Because unfortunately, in the field, in this environment, in a supply chain, it's not something that you can do very well virtually. You have to be hands-on, right? Which is great because it's great job security for people. It's going to be there. You have to physically do it. You have to move products. But we had to do it safely. And so working with different nursing groups and people who understood that we're proper healthcare professionals, helping us do temperature checks, screening questions, abiding by state laws. We put all these countermeasures into place to keep us safe. And so it started with that. And once we got that moving, then we could go back and say, okay, here's our demands, here's what our customers need, how are we going to deliver and still do it safely? So we've moved a lot of things from what we used to be on paper to paperless. More things are contactless. It's actually pushed us in tremendous ways to adapt and become a more efficient supply chain. So it's been really neat to see that process evolve.
The long-term care facility support, that is the most intensive mission that we have, because you're really up front, up close and personal, assisting residents both medically and then some more of the custodial type aspects of laundry, feeding, just general cleaning, because the staff would end up becoming infected with COVID positive, and they would not be able to come into the facility, but the residents still need to be fed and they can't feed themselves. So another thing that came about was public transportation early on was shut down. And many of the workers that would go into these facilities relied on public transportation. They didn't have a means to get in otherwise. Schools were closed, and some workers relied on that school to, as their primary care during the day for their child or children. And so people couldn't come in because they had to care for their child. So it was just so many complex problems that we had to try to overcome as a Commonwealth. And we were one part of that. And on the right-hand side is a table basically that shows by county how many shifts we worked. And some are duplicates because we went to multiple facilities in that county. And as you can see, sometimes we were there maybe just for a short period with a few people. Other times we were there for a month or more with 20 or 30 folks, trying to help them get over a rough patch where, they were missing staff.